Thank you, Rebecca. This is April Flint-Gerner, she, her pronouns, Deputy Director with ODHS Child Welfare over equity training and workforce development. And I'm going to take a couple of minutes to talk to you about just some of the exciting work that's been happening around Guiding Principle 2, enhancing our staff and infrastructure. And usually when we are in these conversations, I spend a lot of time talking about training and workforce development, and where we've made so much progress this year. I really want to focus on all of the work that we've been doing to become an anti-racist organization and to support our equity efforts. So you're going to hear a lot more about that from me today. So, briefly, we've been building out a workforce development structure to provide some, more learning opportunities and promotional readiness and succession planning and, all of that structure is really going to help us move beyond just training to really providing the kind of infrastructure to focus on transfer of learning and coaching. We have developed a new Leaders Institute for many of our leaders and as a space to learn in community with one another. And we're looking forward to how that's going to develop in the new year. And we are doing, so much work right now with the Children's Bureau Capacity Building Center for States to build out the rest of our training infrastructure. So really looking forward to the next time that I come before you. My hope is that we've done some hiring and we've got some folks on board to help us implement the vision that we've created. On the equity front, we're really excited about the work that we have been doing in partnership with our ADA Steering Committee, and that's Americans with Disabilities Act. And that group has been coming together for quite some time to help us improve supports and services and approaches to serving our families with disabilities. And we were really excited to launch Applying the ADA to Your Work with Children and Families computer-based training this year as a mandatory training for all of our staff. And we also finished creating some guides for staff on working with children and parents with disabilities in partnership with the Federal Office of Civil Rights as well, to do some training for trainers around ADA. And so really excited about just the momentum we're building around understanding the needs of our children and families that have disabilities, and making sure that our workforce, our partners are increasingly have tools and approaches in their backpacks so that we can serve families equitably and fairly. Also, we have implemented an equity tool, and we're continuing to implement an equity tool that helps us to look at some of the unintended consequences regarding policy, procedure, and system changes, and really intentionally bringing the voice of those with lived experience and the voices of those that are most impacted by our decisions into our decision making. And so, that tool helps us to look at our decisions, our language, our alignment with the vision for transformation, and more. And this is being implemented and worked on by every program at ODHS, not just child welfare. And that is a huge accomplishment. And this equity tool is really helping us, in some ways we have to look at the things that we already have in place that may be leading to inequitable outcomes, and then we have to do the work on the preventative side, right? And so it can help us do both of those things. So we're really excited to see that tool being implemented now and in the future. We are continuing to have robust conversations around justice, diversity, equity, and inclusion across all levels of our organization, our branches, our districts, our program areas, and our program leaders. And increasingly, it is not just a central office conversation. It is our program leaders out there, our partners. You all are stepping in and leaning in around equity, and we can see it, we can feel it, we can hear it. And we really appreciate all of you partnering with us in that. Now, as the work continues into 2022 and in the future years, it's going to be important for us all to research individually and at our agency levels how we all can work together to improve inequitable outcomes, and how we can work to adhere to both the spirit and intent of ICWA and or ICWA. So we often get asked about disproportionality data, and Mind you, disproportionality is about overrepresentation and underrepresentation, but we get asked about overrepresentation of American Indian, Native Alaskan, Native American, and Black children in the child welfare system. And the fact is that every jurisdiction in this country has an overrepresentation of Black and Native American children. And so when the data is that consistent and seemingly hard to budge, we have to look at the ways that we are structured to continue to get the outcomes that we're getting, right? That racism and poverty are creating these increased likelihood of those children being in our system. It's really important that we all do our research around these kinds of things so that we're coming up with strategies that are not just about child welfare, but we're really moving kind of upstream and downstream and looking at ways in which we can dismantle those structures within our systems that are contributing to racialized outcomes. And so addressing racial disproportionality and disparity is going to take all of us. And, we really want to make sure that we're partnering with communities, tribes, and our system partners to support things like fair and adequate housing resources and practices, dismantling inequities and access to education and higher education, and to some of the other social determinants of health and political determinants of health that help to create equitable outcomes. And so, in this new year, we're really going to look forward to continuing that conversation in partnership with our system, community, and tribal partners. Again, it will take all of us to see the changes that we want to see around racial and ethnic inequities in our society, not just the child welfare system alone. Sometimes what we see, is that folks want to tackle racial disproportionality and disparity by trying to train it away, and that doesn't work. So we really have to have both the equity tools, strategies, and resources at our fingertips, as well as this whole workforce development framework that really says that equity is a part of our work throughout our careers and in partnership. And so, in closing, I just want to say that we are excited about the hiring of the funded positions for the creation of our workforce development and design team for child welfare, that we can't wait to provide more detailed updates on that in the new year, and continue our work with our partners at Casey Family Programs and Capacity Building Center for States to make sure that we are being thoughtful and strategic as we build out this infrastructure, and so that we can live into the vision for transformation. We are excited in this new year that our treatment services program has a 5-year workforce planning committee established in partnership with a full child service continuum, and that work is going to continue. We're excited about the implementation of our child welfare equity framework. We're also really excited about the launch of the Resource and Adoptive Family Training Series that we have developed in collaboration with our partners for years. So we're super excited to get that going. ORCA has continued and will continue to do mandatory reporter outreach and training. And although, there's a lot of work to do around training, equity, workforce development, I feel really just toasty inside about the robust progress we've made on our equity and anti-racism efforts that we are committed to building on in the new year. So shout out to all of you who have partnered with us, helped hold yourselves and us accountable to doing better. We asked you to be uncomfortable. We asked you to lean in around equity. You did it. Congratulations. World's best cup of coffee to you. Great job, everyone. I'm going to turn it over to Alicia to talk about guiding principle number 3.
And I'm going to jump in with a commercial break again. This is going to be my theme for the day. I want to just, from reflecting on some of the things April shared, and this is Rebecca again, is as we talk about workforce development and learning opportunities, we're looking also for the cross-system opportunities where we're doing that together and with our partners in the community. And to the issue around disproportionality, I want to just kind of re-emphasize that the overrepresentation conversation is absolutely also about underrepresentation. And that I just want to highlight that, because that's not a small concept. And it really is a change in thinking about what our strategies are for improving and changing our system to meet the needs of all children and families when they're in crisis and in need. So thank you. And Alicia, it's all yours.
Thank you, Rebecca. Alicia Cox, Child Welfare Deputy Chief for Strategy and Innovation. She, her pronouns. You have seen me talk about, or heard me talk about, or read my emails about guiding principle number 3, enhancing the structure of our system by using data with continuous quality improvement. So this is where I get really excited, because it's the actualization of guiding principle number 3, and the 3 key approaches that I'll talk about. 1, identifying and really improving our current state. 2, bridging those current efforts. And then 3, providing the supports for building a new continuous quality improvement structure, which includes expanding our data understanding, data literacy, and skills for staff, and to support those strategies. It's really the actualization of those 3 pieces that really will uplift guiding principle number 3. For the 21 highlights, I want to really kind of organize my highlights under those 3 kind of approaches to actualizing guiding principle number 3. And it's really the improving our current site by consolidating, streamlining, and increasing our data equity and making it more accessible. Yes, we have lots of data, but what are we doing to make sure that we understand the data and that we have access to the data? So we have a new process for data requests within child welfare workforce, so that we can see themes. Should we notice that a portion of our workforce is really wanting access to this data, is it something that we can create so it's automated, or that is easier, and improve those processes so we can be efficient with the information that we have? And as you know, just because you can't see something doesn't mean it doesn't exist. So same with the data, we know it exists, but how are we accessing it so we know that we can give us some highlights and some of the trends data, so we can apply that into our strategies and improvement efforts. Another highlight for that portion of our actualization is the internal modification of our data management system. We're really working with partners and the layers and improvements. So not only are we utilizing the current systems that we have, but we're modernizing it so it's reflective of our current work. Again, working with our federal partners, we were selected by the Administration for Children and Families, or ACF, or as I like to say, Rebecca's new future boss. And every time I think of like the Administration for Children and Families, I just like to smile, because smiling is my favorite, because at this point you want to continue to do the good work, whether Rebecca's in her seat or not. But knowing that we are one of the 4 states to help develop the National Comprehensive Child Welfare Information System Data Quality Plan, that was a very long name, a very long acronym as well, to help improve us, because it will set the standards for our data definitions, our goals within our system, and so that we can be transparent about where we're moving forward. The second tenet is really bridging our current efforts. So working on projects with focus on outcomes. So we're not just working on initiatives and having FTE or personnel work on any sort of strategies. It's being thoughtful as how they align with the vision for transformation, and prioritizing projects so that we can track those efforts and see there's changes within those efforts using those outcomes. And then exciting news that we get to expand our team to better support the improvements across child welfare. And of course, connecting with our current continuous quality improvement measures and processes, along with our quality assurance efforts, make sure that we are supporting what's already established, and we're not being a barrier to the work that's already happening, but bolstering up our workforce and the staffs that are already doing continuous quality improvement and quality assurance, so that we can give them the supports necessary, so there's this continuous feedback loop and supports. The last tenet is really providing the support for building a new continuous quality improvement structure. Not only is it building one, but having something sustainable. I've talked about the work within the work group, identifying recommendations. Now we're implementing those recommendations so that we can, 1, see some actual changes in the state, and moving those federal measures that we will be seeing a little bit later on. I'm excited about the work that was happened in 2022, because I believe, and it's silly, but I do believe that in 2022, the continued work will happen in creating a data equity strategy plan. This is where I'll be seeking feedback from our committee members, our workforce, our partners, our stakeholders, everyone who's interested or has an interest in child welfare. I do want them at the table as we're building out this data equity plan so that we have the perspectives built, as this will be guiding us forward on our strategies and implementation of continuous quality improvement. And always, again, partnering with the Office of Reporting, Research, and Analytics and Implementation, another long acronym and name, but they're the technology group that's been working with us on building some dashboards internally to help us have access to this information, and then of course externally. And I'm hoping to have some great news before the end of the month for everybody to have access to a dashboard that we hope to build out transparency in our current state. Rather than waiting for those annual reports, we can combine the two and couple those stagnant reports along with some dynamic data. Very excited about that. And with that, I will pass it over to Tim.
All right, well, Tim's coming on. This is your Holly Jolly Child Welfare Director with another break. I want to just reflect on a couple of the things that Alicia shared, is that, you know, we have asked our internal teams to stretch and grow and do things in new and different ways. And that includes our ORCIDS team, our ORAY partners. And so those acronyms, so it's our IT team and our data research analytics team. We've been pushing them in partnership to really grow with us as we create these tangible things to be able to utilize our data and in our decision making, and continue to grow our own skills across our system around how we're paying attention to what our outcomes are and using that in our continuous quality improvement efforts. So I will hand it over to Tim now.
Rebecca did mention that she wanted to interject while she could, and I'm sure that even when she gets her new job, she'll find ways to interject herself. Maybe not in this format, but we'll still be hearing from her. Hi everyone, Tim Gillette again, he, him pronouns, and we're a little behind time, so I'm going to go somewhat quick here, but I wanted to get some highlights about what our operations teams have been doing. I'm really excited about the volume of work that our contracts and our position management teams have been able to do, while at the same time refining their processes in order to provide better customer service, while also improving the way that we work with our partners, both in the Office of Contracts and Procurement, as well as and our the Director's Office as well, as we work through position management roadblocks. So the other thing that, as we look back at 2021, it was another year of testing our ability to do well in the area of continuity of operations. Our fire season wasn't as bad this year as it was in 2020, but it was still a test of our systems, and we certainly did a lot of planning and preparation in order to avoid catastrophic situations. So really proud of the work we did there, and then as well as the work that we did around the vaccine mandate and making sure that that was not going to impact our ability to do our work across the state. So I was really glad that our teams did a great job there. And then the other thing that we did this year that I'm really excited about was we started scanning some of our retention documents. We've got a bunch of files that we have to hang on to, but they're sitting in boxes in storage. And so we're really looking to modernize our system and get some of those papers out of the boxes and into an electronic format. We've talked about doing this for years, and this is the year that we did it. And so we're just getting started. There's still a ton of work to do there, but looking forward to continuing that process and becoming a more paperless division. So excited about that. And then as we look ahead, of course, we're looking forward to transitioning to being more in person than we have been the last 20 months or so. And so we've got more people that are going to be returning into the office. So we'll be making sure that we're doing that safely, putting processes in place to encourage that transition. And then we'll have people working more on a hybrid model, working both in the office, in the community, and potentially from home as well. So we'll be helping a whole bunch with that, as well as continuing to improve the way that we work with our self-sufficiency partners through both contracts, position management, and the other operations that we do across the agency. So super excited about 2020. I think the most important thing for next year is just to treat every day like Christmas, because that's a great way to be. I am excited to get to the Q&A section where we get to answer some of the questions that you all submitted. So I'm going to give it back to Rebecca to kick us off there.
I don't get to interrupt myself here. Thank you. Thank you, team. Again, just a reminder, if you've got questions, put them in the Q&A section, and we will answer them as we're able. And if we don't get to them, we will make sure that we include them in our responses when we are sharing the notes from this meeting. So just reflecting on a little bit on what Tim shared is, this has been a year of kind of transition, change, problem solving when it comes to just even the basics of, do we have the computers for new staff? Are we in person, or are we remote, or are we a hybrid, and what does that mean, and all these sort of things. And I just really want to acknowledge the fact for folks that it sometimes can be feel really exhausting to be in this kind of constant cycle of uncertainty and trying to figure things out and thinking that we've resolved it, and then it's not resolved, and all other things. And so just really, again, wanting to thank everyone and acknowledging how tiring it has been of, half the year with kids not in school, another half in school, but having to drive kids to school, and what does that mean for my own schedule? So just hats off to everyone. One of the questions, there are a couple of questions that I want to kind of start to answer, and then we'll just ask the team to chime in as needed. We did get one question around, what are some of the options around building resources for families that isn't kind of dependent on the legislature giving ODHS funding, or nonprofits who are already strapped financially for doing that. And I think for me, the beauty of building a prevention and well-being system is the collective of all of us. So we all have limited resources in different ways, but if we are really better about how are we kind of knitting together our resources and supports on behalf of communities, it will go farther for us. And so just really thinking about where are the places that we can, collaborate and make sure that, we're using the most effective funding for each thing that we're doing, and then figure out what else is needed. There's just such a wealth of opportunity across our communities here in Oregon, of work that already exists, and of new opportunities for us to partner. So I would be remiss without calling out the fact that, the added challenge that we are all learning, in fact, around the world, is the challenge of workforce. We're going to learn some things that aren't even entirely clear yet around what the impact of the pandemic has had on how people work, and where people work, and what work people do. And that has absolutely been felt here in Oregon, and been part of the challenge as we work with our partners, and in their being able to have children in their services and placements and access to resources and those sort of things. And so just again, wanting to acknowledge that, and that there's a lot of collaborative work that's been going on across systems, across ODHS, OHA, OYA, and other state agencies, but also across the provider community, and with the governor's office and the legislature really looking and exploring, what are the additional resources that were needed for strategies. We were able to, in many cases, offer to providers kind of stability grants. I'm probably going to get the name of them wrong. Stability grants for strategies around recruiting and retaining staff, to having some hard conversations about our structures around rates and services, and dealing with the crisis at hand in the moment when there is a child that needs a placement, and do we have the staff to provide the care for the child, to systemically, what's our opportunity to think about what is the long-term structure and system that we really want to have in place to support children that are in crisis. And so really just wanted to acknowledge that there are some things that we've been able to do collectively, and we're going to continue to discover some new ways as we go into 2022 and the legislative session there, but also as we plan for what are the asks and needs that we bring forward as we do some planning for the next long legislative session of 2023, which seems pretty phenomenal to me that that's what we're talking about. So I'm going to actually turn it, I think, over to Lacey for another question that we'll respond to as well.
Rumor has it the best way to spread Christmas cheer is singing loud for all to hear, but I am going to speak and save you all from the pain of my particular singing voice. When we asked for you to give us questions and feedback, we got several around manageable workload, manageable caseload, and creating mechanisms for staff to really be able to find time to focus and work on the work in a way that feels proactive. And so currently we have just over 4,500 children in foster care, one of the lowest numbers that we've seen in a very long time. And we also have the highest legislatively allocated number of FTE. And so along with all of the work that you heard April talk about around building infrastructure for training and workforce development, because I cannot tell you how very important I think that is for us to have a functioning, healthy workforce in this state. We're also continuing to work to find efficiencies and then sharing those learnings and efficiencies across the state. I'd point to two technical fixes in our information systems that I also think are going to help with managing workload. One is some work we're doing with a contracted vendor to build out a tracking system for the work of retention and recruitment of resource families. And why I think that relates directly to workload is many of you certifiers are doing that by hand on spreadsheets, on legal pads. And also this will allow us to really measure and understand the work of certification in a way that we've never had before. And ultimately a much smoother, easier process, both for our workforce and also for the families who are coming to us for the purpose of foster care or adoption. Second technical fix that's coming in 2022 is an ORCIDS, that's our information system app for iPhones and Surface Pros. I know you should all pause and welcome child welfare to this century, but we're excited about what's possible to that, to be really giving you tools that you can take with you that will help you to be more timely, more nimble, and utilize all your time in a more responsive and efficient way.
So I want to just add to that and highlight an example, using the mobile app as an example. That for me is a demonstration of our friends to the north in Washington have an information system that is similarly built. And there's technical terms to describe how it's similarly built, but they already had figured out some of the mobile app abilities, and we were able to connect with them and be able to share resources in how do we bring that to Oregon. And so, for me, anytime that we are not having to kind of recreate or come up and invent something new that already exists, really is just, an opportunity for us to be efficient in our limited resources, and also learn some things from our other partners in other states and jurisdictions, so that we maybe don't repeat some of the same challenges or hurdles that they've already figured out, and we get to start kind of that much further down the road. And I think, April, you're up next for the next question.
I believe you are right. This is April Flint-Gerner. The question is, what are the plans Child Welfare has to partner both within the agency and externally across all the things? And specifically, what are strategies we are using to integrate familial voice and community and partnerships that are best practices to achieve increased familial stabilization with diverse communities? So I do want to give a little bit of a shout out to Lacey, as she highlighted our family preservation work, our family first work, and having so many of our partners at the table with us in that work. We couldn't do it without you, and really appreciate you continuing to be in it with us, and storming and norming our way through the creation of really meaningful work. There's just a few examples from within this year that I want to highlight, and then I want to talk a little bit about the best practices and partnership aspect of the question. And so, I just heard, I think it was in the last couple of weeks, about some exciting ways that we're inviting folks with lived experience into interview panels for our staff. And every time I hear about that, there is an opportunity and an experience of our folks with lived experience or parent or child voice being in the room, and it absolutely impacting the outcome of key hiring. And so we just want to encourage you all to continue to think about the spaces and paces where we can have folks that are going to be most impacted by that hiring decision in on that interview process. And Lacey also mentioned that updated immunization and vaccination procedure that really invites in and shares power with parents and tribes around medical decisions for their children, right? And so just a couple of quick tangible things. Additionally, we have partnered with some new organizations and some new people, specifically from the Deaf Blind Project and Basic Rights Oregon, to increase engagement and tools and strategies around LGBTQIA+ and serving people with disabilities. We've made real progress in our partnerships, as I mentioned earlier, with our ADA Steering Committee, with our Child Welfare Advisory Council, our Parent Advisory Council. These spaces are probably more inclusive and meaningful than they ever have been. They're certainly more diverse. We're really excited about all the things that we're going to be able to do together, increasing that diversity and lived experience on those committees. And additionally, we partnered around in our approach to the creation of our new resource and adoptive family training series. And we have gotten resounding, kind of positive response from our community and tribal partners alike, and saying, yes, we are about to bring some really, really exciting training and development opportunities to our resource families. And we did that in partnership with people with lived experience. And so just one quick, nod to what does it mean to have best practices in partnership? So really being committed to partnership at every level is what it's going to take. And so while we've done a lot to increase voice and partnership, via central office and what we're coordinating, meaningful partnership best practices are realized when every single one of us is committed to really intentionally partnering and meaningfully at every level. And so we have to be willing to be wrong. We have to believe people when they say something is not working or they're experiencing anything less than the dignity, empathy, and respect that they deserve. We have to look at how inclusive and how much we create an environment of belongingness in these spaces. And it isn't always about community coming to our table. Sometimes we have to go and be willing to sit in spaces where they're willing to invite us to their tables, and they're not always comfortable. And we have to be willing to be uncomfortable and partner at every level if we're going to continue to see the kind of servant leadership that we really want to model in support of the vision for transformation. So with that, I'm going to turn it over to Tim.
I think we're going to go back to Rebecca.
Yes, thank you. Thank you. So we're going to wrap up. We're running out of time. It's been really great to share some of our reflections on all of the work that's been going on and the progress that we've been making this past year and kind of what lies ahead for us in 2022. And I cannot emphasize enough the value of having all of you in this work with us. And so I just, will offer a reminder to, you're going to get a survey again. It's in the chat. You're going to get a survey. Give us feedback about this forum. And do you want more, less, none, or other places and ways in which we can absolutely be engaging with you in the conversations about what's the work to do, how are we doing in this work, and be able to learn from each other. And so just please offer feedback either by way of the survey or through responding to emails or getting in touch with us. It is absolutely needed. And we're wanting to continue to grow and build our skill and practice on making sure that we are getting information to you, gleaning information from you, and then collectively working together. And there are lots of opportunities to be at the table with us, and there's room for everyone on the list. And so let us know. Let us know if you're interested in joining one of the many advisory groups or work groups that we have going on. Just encourage that. And then I just want to wrap up by saying, first of all, so my family celebrates Kwanzaa, which is an African-American celebration. And my favorite day of the 7 days is the second day, and it's Kujichagulia. And it stands for self-determination. And that means that we are able to, in honoring self-determination, we're able to make decisions for ourselves and plans for ourselves. And that has been absolutely a principle that I've tried to live forward with for myself, but really in this work and creating opportunities for everyone, from caseworkers to case aides to community members to parents to young people, to really be engaged in self-determination in this really important work that we're doing. Thank you all for the hard work that you've done, as demonstrated by all of the reflections that we've had. And we've got work to do, and looking forward to what 2022 brings and the lessons that we'll learn and the successes that we'll have. And so just thank you again. Thank you to my team for being willing to show up in a virtual space whenever asked. And we just look forward to what 2022 brings for us. So take care, everybody, and we will talk with you again soon.
Thanks, everyone. Happy holidays.
Thank you all.
Thank you. Bye.